Well, I guess the first question under the Affordable Care Act is why is it being done, and what is important from the perspective of individuals with disabilities or families of individuals with disabilities. The goal of the Affordable Care Act is to cover about 30 million more Americans with medical insurance. And the way that's going to happen is a lot of those people are going to be covered through Medicaid. So anybody whose income is 138% or less of the federal poverty level will have their premiums covered by Medicaid. So in New Jersey, New Jersey's governor has accepted that, and Medicaid will cover people in New Jersey. Unfortunately for residents of Pennsylvania, Governor Corbett has elected at this time not to extend Medicaid to cover people with disabilities in Pennsylvania under the Affordable Care Act. If a person's income is between 138% and 400% of federal poverty level, then they can still get insurance under the Affordable Care Act, and it will be subsidized. For families and individuals with disabilities, probably the most significant feature of the ACA is that a person cannot be turned down because of a pre-existing medical condition. So everybody will be able to be covered. Now, one of the other features that is of interest to people with disabilities is that there are no lifetime or annual caps on coverage. Now, that sounds a little better than it is because while there are no lifetime or annual dollar caps, there are limits on the number of visits, and insurance companies can impose those limits. So as of October 1, these insurance exchanges, they're now called health insurance marketplaces, are open, and they will be available to people online. You can go in now and register for healthcare insurance through an exchange. But you can't get it through an exchange if you're already covered by your employer. If your employer has more than 50 employees and your employer provides creditable insurance which covers minimum essential benefits. Now, one of the other good features about this insurance under the Affordable Care Act is that it's good coverage. So there are certain features which every policy must have, and it's called minimum essential coverage. So it's going to be much better coverage than a lot of people with individuals with disabilities have been able to get. And it's also going to be cheaper for many people. I'm going to be able to get insurance for my daughter with disabilities for about 1/3 of the cost that I have been paying. So it's a great thing for many, many people. Now, the last thing I just want to touch on briefly is a lot of people think, gee, now I can get this medical insurance. Do I still need to do a special needs trust? And for most people, the answer is yes, if you still want to get benefits that are paid for by Medicaid, because the insurance under the Affordable Care Act is really for acute care, hospitals, doctor visits, things like that. It does not cover home care services. It doesn't cover placement in group homes, assisted living, nursing homes, things like that, that services that people with disabilities will need. So for most people who have serious disabilities, they're still going to need to do a special needs trust.